All right, looks like we have most people who have joined so far. So thank you all for coming to our new PSYCKES features training webinar for our recent release 8.7.0, which went live on July 28th. My name is Michelle Ram. I'm from the Office of Population Health and Evaluation, and I will be leading us through today's training. So a bit of housekeeping before we get started. All phone lines have been muted to help prevent any background noise, but you still have the option to ask your questions during today's webinar by accessing the Q&A option, and that will be found on the bottom right-hand corner of your screen. There should be three dots, and once you click on those three dots, there's a select Slido, polling, and Q&A option which you'd click on, and then you can type your question into Slido and click the send message icon, and that'll bring that question right to myself and our panelists to help answer it. So that's how you ask questions during today's training, and I know this is a frequent question we typically get, so we'll keep reminding folks throughout the webinar that the slides and recording link will be emailed to everyone after the webinar is over, and it will also be posted to our public website shortly, probably within the next week or so. All right, so here's our agenda for today. We'll do a quick PSYCKES overview since some of you might be new to the application. So we'll talk about what PSYCKES is, what data is available in the application, who is viewable in PSYCKES, and what reports we have. Then we'll go into the meat of today's training. So we'll review the new PSYCKES features that were just released, and this includes new Medicaid recertification filter options and clinical summary notification updates. We'll also look at the integration of critical time intervention CTI data in the clinical summary. We also will look at the addition of safe option support, CTI, and mobile crisis team data and recipient search as new filters and service settings. And then we've also added home-based crisis intervention services from CAIRS, the CAIRS database. And then there's a couple other new features we want to show as well. And then we'll have a section dedicated to getting your feedback. So we'd love to hear from you on what new features would be helpful for the work that you do in our application. And then we'll end with training and technical support and of course Q&A at the end to help answer your questions. So we'll go ahead and get started with our PSYCKES overview. So what is PSYCKES? PSYCKES is a clinical knowledge enhancement system that's secure and HIPAA compliant. And what PSYCKES does is it integrates multiple data sources to really help support population health, quality improvement, care coordination, and clinical decision making. And our application has ongoing data updates. So we have our quality indicator reports. Those are updated on a monthly basis. And then our clinical summary, that client level detail is updated on a weekly basis. So who's viewable in PSYCKES? Right now we have over 13 million individuals in the application, and this includes individuals with any history of Medicaid-funded behavioral health diagnoses or treatment, or folks who've spent some time at a state BC inpatient or outpatient service, or those who are enrolled or in outreach with health homes. And this information in PSYCKES is not just limited to behavioral health data. It also includes information across the treatment spectrum. So that includes general medical information, crisis-related data. We have residential, dental vision, lab pathology, living support, and more. So our data that we have available in the application, we have our client level clinical summary, and that provides up to 5 years worth of data. And again, that's updated on a weekly basis. So we really have two main buckets of data filtering into our application. The first and biggest bucket, I would say, is our Medicaid fee-for-service claims and managed care encounter data. Again, it's not just limited to behavioral health, it's data across all treatment settings. So this includes information on medications, medical and behavioral health outpatient and inpatient services, ER visits, crisis services, care coordination, again, dental and vision, and more. So the Medicaid data does have a data lag to it. So sometimes from the time the service occurred to where it shows in the application can take upwards of a couple of months. Other times, things like medications, the time the medication's picked up to when it shows in the application, that could be upwards of 2 weeks. So a little bit quicker for certain data to show in the application from the time that service or pickup has occurred. So that's just something to keep in mind with Medicaid data. the data lag. So that's why we have other state administrative databases filing into our application, and those have a 0 to 7 day lag, so they're considered more real-time data. So we have the New York City Correctional Health Services, which provides information on jail admission and discharge, where the client was released to, if they had any medications at the time of discharge, etc. We also have New York City Department of Homeless Services. So this looks at the shelter name, or if that client's in outreach, their admission and discharge date if they did get admitted to a shelter, and the shelter director contact information. Then we have Health Home Enrollment and Care Management Agency provider information. So this is coming to us from MAP, and we are showing the health home referral contact information as well there. Then we have managed care plan and HARP status coming from the managed care enrollment table. We have the managed care plan assigned primary care physician that's coming to us quarterly from the Department of Health. State Psychiatric Center EMR data. So if someone spent some time at a state PC and that state PC didn't bill Medicaid directly, we'd still have that data because we have state PC EMR data as one of our data sources. And then AOT assisted outpatient treatment provider contact information that's included from TACT. And then we have a few data pieces coming from CAIRS. We have ACT, Assertive Community Treatment, Adult Housing and Residential data, and then our newest data source, our piece of data coming from CAIRS is Home-Based Crisis Intervention. So I'll be showing what that looks like in the application today. And then finally, we have suicide attempt information coming from NIMERS, safety plan screenings and assessments entered in by providers, and then IMT intensive mobile treatment. We have AOT referral under investigation and mobile crisis team data coming from DOHMH. So we have what's called quality indicators, otherwise known as quality flags in our application. So these quality flags really help to identify clients that have a particular area of concern in order to help inform you as the treating provider for a clinical review or quality improvement. Now we have our statewide reports and our MyQI reports, and those are updated on a monthly basis. And these reports display the quality indicator prevalence rates at the statewide region, network provider program levels. So right now we have over 80 quality flags in our application, I believe, and these are just some examples of the types of quality flags you can find in PSYCKES. So one would be no diabetes monitoring for individuals with diabetes and schizophrenia, low medication adherence for folks with schizophrenia, folks that are high utilizers of inpatient or emergency room services, and then individuals that are eligible for Health Home Plus but haven't received that Health Home Plus service in the past 3 months or the past year. Now we also have performance tracking indicators, and these are unique indicator sets because they're run by the Department of Health on mature Medicaid data. So the DOH calculates these indicator sets after a 6 or more month billing data maturation period to allow for complete service invoicing to come in. So the as of date for these performance measures is different from our PSYCKES run measures. So there's that 6 or more month data lag. So it's really important to look at the as of date for the quality flag that you're looking at in the application because there might be an intentional lag for those performance measures. All right, and then what types of reports do we have available? We have the individual client level clinical summary, and that takes that Medicaid data and state administrative data, treatment history, and it provides up to 5 years worth of historical treatment information. And then we have our provider level reports. So this includes my QI report. And again, that displays current performance on all quality indicators by showing you the prevalence rate compared to the region and the statewide prevalence rates. And you can even drill into a specific quality indicator and view a list of names of clients who are meeting criteria for that specific indicator. And then drilling down further, you can enable access if you're a provider agency user. And then we have recipient search. So this is where you'll run ad hoc reports to identify any cohorts of interest for the work that you're doing. I'll show a bit of recipient search today. We also have our advanced views. So if you run a cohort search in recipient search, the results page is what's called our standard recipient search results view, but we have the option for you to add on additional columns of interest with our advanced views. So things like complex needs or outpatient providers or high utilization or high risk columns can be added onto your recipient search results page. And then here you can also enable access if you're a provider agency user. And then we have our usage reports. So these are really to help you monitor protected health information or PHI access by staff. So you can see which of your staff have logged into the application, who's consented or provided emergency access to clinical summaries, what clinical summaries have been viewed, things of that nature. And then finally, we have our utilization reports. And this is to help really support provider value-based payment data needs in the application. And then statewide reports, this is again where you can select a quality indicator and review the statewide proportions by either the provider location, region or county, the client residence, region or county, by plan, network, provider, etc. All right, so let's go into the more exciting part of our webinar today, the new PSYCKES features. So we'll start with the hot topic of Medicaid recertification updates. So let's go into what was just recently added into the application related to Medicaid recertification. So based on new federal regulations for Medicaid coverage, PSYCKES is now capturing individuals needing to recertify their Medicaid coverage via the New York State of Health, the NISO, or their local Department of Social Services, LDSS. So what we have in Recipient Search in the Cohort Search tab, we have a Managed Care Plan and Medicaid section, and there's a Medicaid enrollment status dropdown located there. And recently, as of July 28th, we've added a few new filters in this dropdown. So we've added inactive Medicaid for folks whose Medicaid has expired already in the past 3 months or the past year. And then we've also added Medicaid recertification for folks who need to recertify within the next month. And you can either run a general cohort search for anyone who needs to recertify in the next month, or you can specify, I only want to see folks who need to recertify via NISO or folks who need to recertify via LDSS specifically. Now, in recipient search, when you do run any type of cohort search or individual search, we have a planning considerations column, and that includes information on Medicaid recertification. So it'll show you a Medicaid recertification alert or an active Medicaid alert, along with the expiration date for when that individual either needs to recertify by or the time that the coverage had actually expired for that specific person. And then in the clinical summary, we have a new and active Medicaid alert notification. So that'll show when applicable to the client, this client's Medicaid coverage expired on, and then the date of coverage expiration, and then a link for how they can reapply for Medicaid coverage. And this data is refreshed on a weekly basis. And one other thing I want to point out about the planning considerations column is that you can see this data regardless of consent status for an individual. So if you don't have consent or emergency access to drill into that person's client level detail, you can still see if they have a Medicaid recertification or an active Medicaid alert. So here's what that looks like in the application. We have in recipient search, we've gone to the cohort search tab. We're in the managed care plan and Medicaid section, and then we've opened up the Medicaid enrollment status dropdown. So here we have three subtypes. We have Medicaid status, Medicaid type, and Medicaid recertification. So our newer filters are highlighted here. We have under Medicaid status, you can look for individuals that your agency has served that have had their Medicaid expire in the past year or the past 3 months. And then below that, last release, we had added Medicaid recertification due within the next 3 months. But with our latest release, we've added in an even more up-to-date filters for folks who need to recertify within the next month, because that would be a little bit more urgent than the folks who need to recertify within the next 3 months. So you can really capture who needs to take some next steps for their Medicaid coverage as soon as possible. So in this example, we've run a search for Medicaid recertification due within the next month, and I'm logged in as Main Street Agency. I can see 510 recipients were found that do need their Medicaid recertified within the next month. So this is our recipient search standard results page. We can see that client's name, their Medicaid ID and date of birth, race and ethnicity, their managed care plan, any quality flags they meet criteria for, the planning considerations column, and then the current PHI access level I have to that person's clinical summary if I do have any access. So highlighted, we have the planning considerations column, and here's just an example of what it would look like. I ran this search earlier in August, so I can see a list of people who need to recertify by the end of the month. That's when their Medicaid coverage is set to expire. So I can see Medicaid recertification alert expires 8/31/2026. And again, I can see this data even without access to that client's clinical summary, even without consent or emergency access. And this can be exported to PDF or Excel. And then this is another example of what it would look like if you ran an active Medicaid filter for folks whose Medicaid expired within the past 3 months. So I can see 861 people at Main Street Agency had their Medicaid expire within the past 3 months. So here I can see again, regardless of consent status, this person's Medicaid recently expired at the end of June. This person even more recently at the end of July. So you can drill in if you have access to that person's clinical summary and use a link to help them reapply for coverage. All right, so here's an example of the Medicaid recertification LDSS notification in the clinical summary. So we've drilled into a client's clinical summary that we have access to through consent or emergency access. And on the top, we can see the date the Medicaid eligibility expires, which is August 31st, 2026. And below that, we have the notification section highlighted. And this is where you'll see the Medicaid eligibility alert. So in this example, this person has to recertify through their LDSS, and they're set to expire at the end of August. So you have links here for how to renew, the contact for the client's county LDSS, and then a facilitated enroller link if the client needs help with recertification. And then just another similar example, but this one's for the New York State of Health Medicaid recertification. So here we have very similar wording that the client needs to recertify, but through the New York State of Health enrollment system. And then you'll have the NISO phone number along with a website on how they can renew, or there's a link to an enrollment assister if the client needs help re-enrolling through NISO. All right, and then next we have the newest notification in our clinical summary, the inactive Medicaid alert. So this is just an example of what that looks like. So in the notification section, you can see this client's Medicaid coverage expired at the end of June, and then you have a link for information on how they can reapply for coverage. So that's the end of our Medicaid recertification updates for now. We are looking to increase our features related to HR1 in the Medicaid expansion population. So that should be upcoming in the near future. But so far, just wanted to showcase what we had in the application at this time related to Medicaid recertification and coverage. So more to come on that, that's for sure. So the next section is integration of critical time intervention or CTI data in the clinical summary. So CTI is a care management service designed to support adults with serious mental illness. And the teams coordinate services and provide targeted support to really help facilitate successful reintegration for that client into the community. So in PSYCKES, in the clinical summary specifically, we've added CTI information, and it can be displayed in the following sections just when it's applicable to the client. So it'll show in the current care coordination section if that client was enrolled or discharged from CTI services in the past year. It will also show in the care coordination historical section, and then the integrated view of services over time graph. And the CTI data is coming to us from REDCap, and it's updated on a monthly basis. So these are the details that would be included in the clinical summary for CTI data. So in the current care coordination section, if that client has received CTI services in the past year, you will see the CTI team name, the referral date and referral source, the admission date, and then if they were discharged, you would see the discharge date, the discharge reason, and any discharge notes if that's available from the data source. And then it would end with staff information. for that CTI team name. And then we have care coordination. That's the historical care coordination section. And that includes the service type, which would be CTI. We have the CTI team name, which would be listed under the provider name column, the first and last dates billed, the number of bills, and then the procedures column would show you if there was an attempted versus successful contact, the type of service, such as care coordination or crisis prevention, the targets involved, which would be the client or the external provider, or maybe a family or friend. And then we have the modality, like phone or in person, the location, and the length of contact for that CTI encounter. So I want to show what that looks like in the clinical summary. So we are in the clinical summary in the brief overview screen. In the current care coordination section, here you can see highlighted the CTI data piece. So we have the CTI team name in the first line. Then we have the referral date and the referral source. So this client was referred at the end of 2025 from a hospital inpatient unit. They were admitted and discharged. And now we can see the discharge reason was referral to a higher level of community care. And then discharge notes state that they were transferred to a psychiatric inpatient service. And then we're ending with staff information. So that's the current care coordination section showing here because that person was receiving services for CTI within the past year. Then the integrated view of services over time, also known as the IVOS graph. This will show CTI services, so you can see any treatment history or patterns for CTI here in a visual graph or in a table view, and it'll show each specific CTI service as a singular dot. So you can hover over that particular dot and see the CTI team name and the date of that specific CTI service. And then we have the care coordination historical section. So here we can see CTI information, the CTI team name, the first date billed and last date billed, and then the total number of bills or services for CTI. In the far right column, the procedures column, you can see the most recent quote unquote procedure for the most recent CTI service. So we can see on 3/23/2026, it was a successful contact for care coordination, external provider or service agency, the phone, and it was at the location of the inpatient ER, and it was less than 15 minutes. So if you want to drill in to see each specific CTI service detail, you can drill in and see the date of service, the provider that provided that CTI service, and then the procedures column will show you those specific details such as successful or attempted contact for that specific service date. All right, that was adding CTI to the clinical summary. So now we'll go into SOS CTI mobile crisis filters that have now been added to recipient search. So we've added new service settings and new high need population filter drop-down options in the recipient search cohort search page. So these include safe option support, critical time intervention, and mobile crisis, which is coming to us from DOHMH. So on the left-hand column of the table, you'll see the two high need population filters that we've added, which is SOS enrolled or discharged in the past year, or CTI enrolled or discharged in the past year. Then services by specific or any provider. In the care coordination category, you'll see CTI and SOS listed there. And then the crisis service category, we'll see mobile crisis listed there. All right, so let's just show what that looks like. So we're in recipient search and we've gone to the cohort search page. We've expanded the high need population filter dropdown and highlighted here is where you'll find safe options support, enrolled or discharged in past year, and then CTI enrolled or discharged in past year. So we ran an example search here to see who has been enrolled or discharged in the past year for SOS, and I'm logged in as Main Street Agency. So I can see 32 people had received an SOS service in the past year. So I can drill into a clinical summary if I have access, and I'll just show what that SOS message looks like in the clinical summary. So I'm in the brief overview right now, but you'll see the same data in the full summary. And in the current care coordination section, you can see safe option support. You can see the SOS team name, the enrollment and discharge date, and the discharge reason. So this person, even though they were enrolled all the way back in 2024, SOS data is showing in the current care coordination section because they were discharged within the past year. And we can see they were discharged for completion and graduation. And then we have the main contact email for the SOS team. And then more information on SOS can be found at this link. And I do want to note here that SOS will only appear for members enrolled in the SOS program. Clients in outreach will not show the SOS flag, but this data is updated on a weekly basis. So if somebody was recently enrolled and you're not seeing them in the application, just wait till the following week's refresh, which usually occurs on Monday or Tuesday, and then check again to see if that SOS data has populated. So as a service setting, we're in the services by any provider section in Recipient Search. So if your agency provides CTI, SOS, or mobile crisis, you can find these service settings in the service specific provider section. But right now I'm down a section to the services by any provider section, which will show me if I'm logged in as Main Street Agency, which of my clients have received one of these services from any agency throughout New York State. So I've expanded care coordination here, and this is where I can find CTI and SOS. And then in the crisis services section, if you expand that, this is where you can find mobile crisis as well. And it defaults to the past year to see who have I served at my agency that have received one of these service types from any provider in New York State within the past year. So I'll show an example of that. So logged in as Main Street Agency, I can see that I have 7 recipients found. So I can see for those who I've served at Main Street Agency, 7 people have received mobile crisis services from any provider in the state within the past year. So if I have access to, I will drill into the clinical summary to get a little bit more detail on that mobile crisis service. So here you can see we're in the brief overview in the notification section. This person had mobile crisis services, and you can see the name of the mobile crisis team, the referral date and referral source, any presenting problems, any provisional diagnoses. Was the case opened? Yes, the current status, and then the reason. So mobile crisis data is updated on a weekly basis. And those are our newest service settings and filters in Recipient Search. So now I'm going to move into home-based crisis intervention, our newest service setting from CAIRS. So home-based crisis intervention, HBCI, provides short-term intensive in-home crisis services that are really designed to prevent unnecessary psychiatric hospitalizations for children and youth who are at imminent risk of crisis. And we've added a new HBI service setting directly from CAIRS to our recipient search cohort search page within the service setting box, and then also within the clinical summary. So in the clinical summary, you can see HBCI information when applicable to the client in the current care coordination section if that client had received HBCI services within the past year, in the IVOS integrated view of services over time graph, and in the crisis services section. And again, the source for HBCI is CAIRS, and it's refreshed on a weekly basis. So the data that would be included in the current care coordination section would be the HBCI provider name, the admission date, and then if they were discharged, it would be the discharge date, the discharge reason, and any discharge comments that were included. And then you'd finally see at the bottom the program contact information for that HBCI program. And then in the crisis services section, this shows the historical HBCI services. So under service type, you would see HBCI, you would see that specific provider name, the admission date, the discharge date, and the discharge reason. And then we have HBCI also located within the services by any provider recipient search box, and in the services specific provider section if your agency provides HBCI services. So You would have to expand the crisis service category, and then highlighted here is HBCI, and noting the source is CAIRS. So that's a way to search for a cohort who has received HBCI services from any provider in New York State within the past year. So in the clinical summary, we're in the brief overview again, but again, the same information will show in the full summary view. But here in the current care coordination section, you can see highlighted HBCI, home-based crisis intervention, and we have the provider name, the admission date, and discharge date. If they weren't discharged, you would only see the admission date, and then the discharge reason and the discharge comments, along with the program contact information, would be included if that data is available. Then we'll scroll down on the brief overview, and this is specific to the brief overview page. We have an all hospital and crisis utilization section, which looks back the past 5 years. So this format of how you're looking at this data is specific to the brief overview. So here you can see in the crisis services section, this person received HBCI from one provider, and this was their last service date, and their latest provider they received HBCI services from. And then this is what it looks like in the full summary view. If you go down to the IVOS graph, you can see HBCI services here if the client had received them within the past 5 years. And then if you hover over the HBCI line, it'll show you the provider along with the date of service. And then lastly, in the crisis services section, this is where you'll find historical HBCI information. So we can see the service type shows us HBCI along with the source, the provider name, and then the admission and discharge date. If you want to see a little bit more information, if it's available, you can drill into these details and then see in the procedures column the discharge reason for HBCI if they were discharged. All right, so going into one of our last updates for our new features, I think we have one more after this, but this is episode-based CARES data. So in the clinical summary, we have in the living support residential section made improvements to help you more clearly identify CARES episode-based services. So previously, CARES services looked like a singular date and time service, but with this update, we're now including both admission and discharge dates when that client has been discharged, if that date is available, to identify that an episode-based CARES service has occurred. If the discharge date's not available, then the word current will be displayed in the last date billed/discharge column to show you that the individual is still actively enrolled in that CARES program. And then in the IVOS graph, we are going to be showing these episode-based services as a line rather than singular service dots, so it can help you more clearly visually identify that an episode has occurred. So I'll show what that looks like here. We have in the living support residential section of the clinical summary, in the full summary view, we have the service type, provider name, first date billed admission, last date billed discharge, number of visits, and then the option to see more details. So these highlighted rows show CARES services for apartment treatment model and then congregate treatment model. So here we can see this person was admitted on 8/1/2025 and then discharged on 9/23, and then transitioned over to the congregate treatment model at that same provider from 9/23 to 3/12/2026. If they weren't discharged yet from the congregate treatment model, this specific cell would show the word current. So if we drill into the details here, we can see the specific dates of service. Again, before these just looked like a singular date, the first date billed, but now we're including that discharge date. And if somebody is currently still enrolled in that specific CARES program, it would show the first date billed - current. So here you can see the dates of service, the service type, the provider, and then the reasons for discharge if they were discharged and if that data is available. And then this is just what it looks like in the integrated view of services over time graph. So here we have the congregate treatment model and apartment treatment model CARES services. Rather than singular service dots, we have lines now that just show you the complete episode that had occurred within the past 5 years. Okay, so we'll go right into our mobile app enhancements. We've made quite a few mobile app enhancements this release, and I'm not sure if everyone's familiar that we do have a PSYCKES mobile app. So I wanted to let everyone know that we have a PSYCKES mobile app. It's free in the App Store for iOS and Android, and it really allows users to search for clients from the field. You can access a clinical summary if you have consent or emergency access. We have an e-sign PSYCKES consent feature on our mobile app, and you also have the option to complete a safety plan or a screening and assessment within our PSYCKES mobile app. So with this latest release for our 8.7.0 enhancements, we've created a brand new Android tablet version of the PSYCKES mobile app, which really mirrors the iOS iPad view. So the tablet and iPad specifically have a brief overview screen and a services over time graph. Both the tablets, the iPads, and the phones all have the option for you to create safety plans and complete screenings and assessments. So we're really excited about our Android tablet view. And then also in the mobile app, we've added planning considerations, which is available now in the recipient search results screen. So it mirrors the web. When you run a search for an individual, you'll be able to see their planning considerations data now in the mobile app, the exact same data that's showing in the web. And then we have added the inactive Medicaid clinical summary notification, CTI data, HBCI CAIRS service setting is now in the mobile app. And then we've also updated the episode-based CAIRS data as well. So I'll show what that looks like. We have our new planning considerations data now included in the mobile app, both phone and iPad tablet views. So if you run a search for an individual, you'll see their name, their date of birth, their race and ethnicity, their Medicaid ID, their gender, and then highlighted here is where you'll see that planning considerations data. So we have notifications here, and this is a good way to see on the go if you're out in the field, if somebody needs their Medicaid recertified, if they're complex needs, if they're meeting complex needs criteria, or if they're eligible for Health Home Plus or OPWDD services. We can see this person has an outdated safety plan back from 2024. So maybe we'd want to drill into their clinical summary if we have access and work with them to create an updated safety plan. And then our e-sign PSYCKES consent feature. I always like to showcase this because it's specific to the mobile app. So this is where you'd search for a client, and in this example, we don't have access to their clinical summary. So you can tap on Enable PHI Access, and this is where you'd have the typical access options that you'd see in the web, like consent or verbal consent or clinical emergency. But what's special about the mobile app is we have this e-sign consent feature right at the top. So if we tap on that, I'll just bring you through the flow of e-signing the PSYCKES consent with a client. So the first screen will show you the overview of e-signatures. So first you'll confirm the client's identity, review the consent form with them. They will give or deny consent, and if they do give consent, then they'll sign right on the mobile device screen. And then after the client signs, it just explains that you'd have access to their data for 3 years after the last billed service. The completed consent would be saved in their plans and documents section in the clinical summary, and a copy should be provided to that client within a reasonable time frame. So that's the overview screen. And then the next screen would be, how do you know this is the right person? You as the provider can attest to the client's identity or note that the client provided one form of photo ID or two forms of non-photo ID. So when you tap next on the screen, then that's when the client and you would review the PSYCKES consent form together to ensure they're making an informed decision. Then the next screen would give the client their choice to give or deny consent. If they do choose to give consent, it'll ask who is signing the consent form, either the client themselves or a legal representative. So the next screen would be the signature of that client if we're having the client sign, and this is where they just use their finger and sign right on the mobile device. And then the next screen would be just to confirm, to save that client's signed PSYCKES consent form. It'd be a confirmation page, so you tap confirm, and then you'd see this confirmation message that it's been saved to their clinical summary, and you can drill right in to view their clinical summary details. All right, and then we wanted to just showcase the iPad and tablet view of our mobile app. So this brief overview screen only exists in the iPad or tablet, just due to spacing. It's not existing yet in our phones, just the iPad and tablet view. So we have the overview section here in the left-hand navigation menu, and this data again mirrors exactly what's showing in the web. So it's just a way to view a quick snapshot of the client's clinical summary when you're out in the field and on the go. And then the iPad and tablet specifically also have a services over time graph. It's a little bit different from the web in terms of the web gives you the past 5-year look back, where the mobile app is just the past year. But you can still see a quick visual of their service history and treatment patterns, and then you can tap on specific service dots or lines to see the provider and the date of service. And then I wanted to just showcase our safety plan option in both. This is available in both iPads, tablets, and phones. If you drill into a client's clinical summary, there's a plans and documents section you can tap on, and this is where you can complete a safety plan for a client. So you can go through and fill out each section. If you need to stop midway through for some reason, you could always close and save a draft and come back to it later. So once you complete that, you can add it to the clinical summary and it'll be available immediately in that client's data. And then lastly, the mobile app screenings and assessments. So this is in the screenings and assessments section. You have the option to complete a depression screening, PHQ-9, or a suicide screening, the CSSRS, right within the mobile app. So once you fill that out and add it to the clinical summary, you'll be able to see the results, and it would be linked right to their data immediately after completing that screening or assessment. Right. So this is the fun part, the interactive part. We'd really love to hear your feedback. We have a few, about 3 different polling questions we wanted to ask everyone to help gather your feedback and hear what would be helpful for you and the work you're doing to have in our PSYCKES application. So there should be a Slido app available in the bottom right-hand corner of your screen. It should be if you tap on the 3 dots, uh, the Slido pop-up should appear. So we're gonna start with our first question, and I will pull that up on the screen. Would you like to see any enhancements added to recipient search? So any new filters you can think of, any new demographic or social needs options, new service settings, any new filters that you could think of that would be helpful to have as a cohort search feature in recipient search that you would like to see in the application. And I want to just make sure that our polling is working as expected. Cameron, let me know if there's any issues. I can't see. Let me see. Oh, there we go. Okay, it looks like it's live and we have 8 or 9 votes so far. That's great. Let's see. Okay, we have medically fragile, foster care, LTSS, K codes. This is really great feedback. We do actually have K codes in a child waiver status dropdown in recipient search. So it's good to hear that that will be helpful for you. All right, we have resides alone or with others. I'll give it another few seconds. Medicaid recertification information, health home population type, such as transitional youth, SNAP benefits.
Hey,
This is
Michelle.
great feedback.
I'm
Hey,
seeing a
Kristen.
lot of, hey, I'm seeing a lot of great feedback. And I think what would be great is I'd also like to identify for the people who are submitting this, again, we so appreciate it. I think we would want to do a follow-up because there are certain things that I'm seeing suggested that already exist in the
Mm-hmm.
application. So that might be a better way for us to maybe tailor some of our future trainings to make sure that we cover some of that, but then also be able to follow up with people related to some of the features that we don't currently have. Because one of the things that we'd always want to make sure is that we understand what the ask is, as well as where that data source exists, because that's exactly how we get new data sources into the PSYCKES application. I was seeing a couple examples for like a completed annual physical. So getting a sense of where we'd be able to get some of that data would be really helpful. But this is great, and I really appreciate all the participation here.
Mm-hmm. Yeah, that's a great point, Kristen. This will definitely help to inform future trainings and also help us dive into some new features we haven't quite heard of or thought about yet and seeing where we can get that information from. So we'll definitely be following up with a few of you on your responses. So thank you so much. We'll go right into the next question now. Are there any additional data sources you'd like to see added to PSYCKES? An example here, we had cost-related data, OTDA, any other data sources that would be helpful for you to have in the application that we don't already have? Seeing none. HRA.
I really like Barbara's suggestion about the New York State Medicaid social care needs screening data as well, because I think that there was a completed New York State Medicaid social care needs screening date as one of the requests for what we could do in recipient search. But I think like that actually comes into question too, because if we had that as a data source, that social care needs screening information, we absolutely agree, because being able to bolster up some of the social determinants of health information that we have, because currently right now we only have from the Medicaid Z codes, but if there was other data sources, especially for a lot of the outpatient providers who are doing those social care needs screenings, if we got a way to, show that information in PSYCKES, I think that would absolutely be a benefit to our users. So that was a great suggestion.
Mm-hmm. Yeah, I'm seeing other people agree in the votes. Thank you all for your feedback. This is extremely helpful. I'll go on just for time's sake to our final question. Would you like to see any functionality updates within the application? A couple of our recipient search filters like complex needs and homelessness has multi-select capabilities where you can select more than one option in the dropdown. Would more of those options be helpful to you? Would you like additional look back periods? Any other thoughts on functionality updates that would be helpful for you in the application?
And while we have people adding here, I think somebody again in that first poll had made mention of basically pulling out the expiration dates to be their own column. Because currently the way that it works in the planning considerations, as Michelle went through, is that we'll put somebody has a Medicaid eligibility alert or an inactive Medicaid alert, and then in parentheses, we'll include the date. So what we were hearing in the suggestion from the previous poll was it would be easier if that information could be in its own column, so you could make sure that you're able to quickly identify that, or if you're exporting it, quickly pull that information without having to do maybe some extra manual cleaning up. So that was a great suggestion.
All right, I'm seeing additional look back periods also, multi-select, bulk search, not cohort search. All right, I'm going to leave this last poll open as I continue on to another way to submit feedback. So if you're interested in adding any future requests for Psyches features, you can email our Psyches help desk, psyches-help@omh.ny.gov. And if you could include the following information and try to be as detailed as you can be, is helpful for us just to learn more about this description of what you'd like to be added to the application, the purpose that the new feature would serve, and then how this new feature could help a larger group of users. Basically, like what the use case for that new feature would be. So that's how you can submit additional feedback to us. And then I'm gonna go to our training and technical support section. So we have a lot of resources available on our Psyches website, psyches.org. We have a bunch of different webinars available. Some are role-based, some are feature-based. We have release webinars like the one you're in. So that's available on our Psyches training webinars page. We also have user guides which go into each section of the Psyches application and how to use that section, the filters that are included, the functionality, etc. And then we do have short how-to videos, for example, how to use the self-service console, how to review a client's clinical summary, which we are working on updating and adding more to. And then technical support, we have our Psyches help desk listed here. We're available Monday through Friday from 9 to 5. So if you have any questions about the Psyches application, about a feature, or if something is not looking right to you, you can always reach out to our help desk. And we will follow up within 1 business day. And then if you are having issues with something like your token or logging in, we have the ITS help desk chat and phone number here if you're an OMH or state PC employee. And then if you're a non-OMH or non-state PC employee, we have our OMH help desk with the phone number and the health help email listed at the bottom. So I'm going to leave this technical support slide up, but I think now we can go into any questions that came in, Ashma. If you want to get started on um, the first question that came in that we can help answer.
Hi, Michelle. So we did receive a few questions, and the first one is, when you say Medicaid recertification data is coming from NISO or LDSS, is the recertification data being pulled from the Medicaid Data Warehouse, MDW? If not, which data source is it coming from?
That's a great question. It is coming from MDW, and within MDW, it'll indicate if somebody is LDSS or NISO for recertification. So that is the current data source we're using.
Thank you, Michelle. And we do have additional Medicaid recertification questions. So the next one that we have is, in the cohort client level report, you can select to see Medicaid recertification dates for a specific time period, for example, 3 months, etc. But it does not give the actual recertification dates. Can we see the actual dates anywhere?
I want to just understand that question a little bit more. Are they saying they are seeing the Medicaid recertification alert, but no date indicated with it?
I think from what I've understood the question, they were asking in the filters itself, it only shows 1 month or 3 months. It doesn't show the actual
Oh.
date.
Mm.
But once you complete the search, is there a way to see the actual dates?
Oh, okay. I think I understand what that person's asking. So when you do run the search, the dates would show in the planning considerations column for when that person needs to recertify by. Um, but if I'm not answering that as needed, please feel free to write back in.
Thank you,
Hi, Michelle.
Michelle.
I think they're asking more is that if there is a different like way, so instead of being stuck to 3 months or 1 month, if there was like a different window of time that we could consider being like, I want to see if somebody has to have their Medicaid recertified within 2 months or a different time frame. So we can always take that back and look into. And if there is a more appropriate time frame to look back, please feel free to include that either in the chat or in the polls or reaching out to us in Psyche's Help.
Right. Thank you, Kristen and Michelle. And then we had a question regarding the automation process. So the user wrote in that they would like to integrate some of the information into their EMR system, but find manual pulls and uploads to be problematic and time consuming. Is there any way to build APIs to get certain information directly into their systems through an automated process?
That's a great question. I would think that might be something we have to take back, Kristen, unless you are thinking of a different answer for that
No,
one,
I
for an
think
API
no,
process.
yeah, no, I really like that question because that is the future interoperability. So being able to pull in data into your EMR, and that's like the way for, especially for providers, instead of having to go to all of these different siloed locations to collect data on the same client, if all of that information could be contained within your EHR or EMR, that would help reduce provider burden and also make that data available, especially if you're getting it from other places. I know that some EMRs even have a single sign-on to the QE, so they have the opportunity to look at the information there. So I just wanted to share that we are in the process right now of exploring interoperability, and future state, that is definitely one of the things that we would look to do, being able to send information directly into EMRs. And just to again reiterate that that is something that we're currently exploring, and any information that that user wants to provide to us in the PSYCKES help desk by sharing their agency, their EMR vendor, and any other projects that they have done that, you know, from a different data source outside of their EMR, integrating that, that's great information for us to be able to review and then always reach out once we're at that state of when we can run certain pilots and get to that state of interoperability.
Thank you, Kristen. And then we have one additional question regarding the Medicaid recertification alert. So one of the users wrote in that they are seeing instances where planning considerations list Medicaid recertification alert with no date. How should we be interpreting the Medicaid recertification alert when there is no date present?
Mhm. I would take that as that person has open-ended coverage based on the MDW data source we're receiving Medicaid recertification alert dates from. However, once the recertification date is populated with an MDW, then it would show in the application. But for now, they technically have open-ended coverage. Um, Kristen, was there anything you wanted to add to that one?
Yeah, I think it's just kind of a timing issue sometimes that we'll have in the application, because by the time we run on a monthly basis, the information that we have and pulling in from different data sources, this person might have had a recertification alert. And then not unfortunately, but due to timing considerations, then we might have updated information letting us know like, oh, that person actually ended up getting recertified. And that's why that information is blank and you have that open-ended place. So we're working on that timing issue. As Michelle mentioned, we currently get those expiration date information from MDW, but MDW has lags. So if we had access to data sources like NISO specifically, and then soon to be MECM, that would be a way for us to get more real-time information and be able to display those expiration dates with, you know, less issues with timing.
Thank you, Kristen and Michelle. And we had another question where a user asked, how do I know if our organization is enrolled to use PSYCKES?
Oh, that's a great question. So you can reach out to our PSYCHES help desk, and we can check if your organization already has PSYCHES access, or go through our eligibility criteria to see if your agency meets one of those criteria listed, and then we can begin the PSYCHES access request process. So feel free to reach out to our help desk and we can let you know next steps.
Thank you, Michelle. And then regarding the data in PSYCKES, one of the users wrote in if this data is all real time. If not, how often is data updated in PSYCKES?
So some of the data is coming to us from Medicaid billing, which does have a lag. The state databases are considered more real time with 0 to 7 day lag, and it's updated on a weekly basis. So I believe it's usually in the beginning of the week, Monday or Tuesday, that the weekly real time data is refreshed.
Great. Thank you, Michelle. Those were all of the open questions that we had. For the other ones, we have responded in the Q&A. So I will pass it back to you.
All right. Well, thank you so much, everyone, for joining. Thank you for your thoughtful feedback and questions. And we really just appreciate your time joining us today and listening to our new features that we have in the application. So, any other questions, please always feel free to reach out to our help desk. But with that, I hope everyone has a wonderful rest of your day. Take
And
care.
Michelle, just before we end, I just want to, because I think this came up a few times in the chat, we will be sending the slides and the recording to everybody who attended and then later posting this on our website. I know sometimes if people miss the beginning of the training, they might miss that.
Gotcha. Thanks, Kristen, for reiterating. All right, take care, everybody. Thank you for joining.